WHO advises not to use non-sugar sweeteners for weight control in newly released guideline. The World Health Organization has released a new guideline on non-sugar sweeteners, which recommends against the use of non-sugar sweetener to control body weight or reduce the risk of noncommunicable diseases. The recommendation is based on the findings of a systematic review of the available evidence, which suggests that use of non-sugar sweetener does not confer any long-term benefit in reducing body fat in adults or children. Results of the review also suggest that there may be potential undesirable effects from long-term use of non-sugar sweetener, such as an increased risk of type 2 diabetes, cardiovascular diseases, and mortality in adults. Replacing free sugars with non-sugar sweetener does not help with weight control in the long term. People need to consider other ways to reduce free sugars intake, such as consuming food with naturally occurring sugars, like fruit, or unsweetened food and beverages, says Francesco Branca, WHO Director for Nutrition and Food Safety. Non-sugar sweetener are not essential dietary factors and have no nutritional value. People should reduce the sweetness of the diet altogether, starting early in life, to improve their health. The recommendation applies to all people except individuals with pre-existing diabetes and includes all synthetic and naturally occurring or modified non-nutritive sweeteners that are not classified as sugars found in manufactured foods and beverages, or sold on their own to be added to foods and beverages by consumers. Common non-sugar sweetener include acesulfame K, aspartame, advantame, cyclamates, neotame, saccharin, sucralose, stevia and stevia derivatives. The recommendation does not apply to personal care and hygiene products containing non-sugar sweetener, such as toothpaste, skin cream, and medications, or to low-calorie sugars and sugar alcohols, which are sugars or sugar derivatives containing calories and are therefore not considered non-sugar sweetener. Because the link observed in the evidence between non-sugar sweetener and disease outcomes might be confounded by baseline characteristics of study participants and complicated patterns of non-sugar sweetener use, the recommendation has been assessed as conditional, following World Health Organization processes for developing guidelines. This signals that policy decisions based on this recommendation may require substantive discussion in specific country contexts, linked for example to the extent of consumption in different age groups. The World Health Organization guideline on non-sugar sweetener is part of a suite of existing and forthcoming guidelines on healthy diets that aim to establish lifelong healthy eating habits, improve dietary quality and decrease the risk of non-communicable diseases worldwide.